Hi everyone, Dr. Remy from Pain Free Infinite Posture Size. Today we're going to be talking about how to help your degenerative disc disease by altering your sleep position. Hope you enjoy. So whether you have degenerative disc disease of the lower back or the neck, keeping in mind what your typical posture and movement tendencies are during the day is an important part of setting yourself in the proper sleep position during night. When we sleep and the body becomes recumbent and no longer weight-bearing, disc pressure increases because water fills into the disc. The disc imbibes or brings in water overnight because it doesn't have its weight-bearing sitting or standing stress on those discs. So in the morning, your discs are more full of water. If you have any herniations, if you have protrusions or bulges, they're more likely to become symptomatic first thing in the morning because your disc is loaded with that pressure. You have that pressure pushing out. As the day goes on and you have movement, that disc pressure decreases because the water content decreases as the day advances. Now, how does posture and movement tendency relate to that? Well, most people with degenerative disc disease have some type of asymmetrical posture and movement habit that they get into. If it's a lower back problem, many times they'll have a tendency to tilt the pelvis up or down. Normally the pelvis should be level where the pubic bone and the tailbone are level. That's a consideration when we sleep. Most people have a tendency to turn one leg outwards more than another. When they're standing, walking, or even when sitting, they like to cross one leg over another at the ankle or at the knee. Even sitting with one leg out, let's say driving. Over time, that side that turns out has a tendency to tighten the piriformis muscle and change the mechanics of the hip so that as you sleep and sit, that hip will be higher than the other. When one hip comes up, or if you have a tendency to lean to one side, sitting or standing more to one side than another, that side is going to compress your degenerative disc problem in your lower back. If you have a tendency to lean your head to one side, talking on the phone, computer work, reading, sleeping on your side with a pillow that's not the same distance between your ear and shoulder, you're going to have a tendency to lean your head to one side or another. If you have a tendency to elevate one shoulder up, that's going to create compression on one side of your neck and an overstretching on the other. Those are typical posture problems that repetitively over small stresses as they add up during the day and the night wind up causing this asymmetrical stress going into the degenerative disc and aggravating symptoms. If you have a tendency to turn your hips more to one side, some people when they're sitting watching television, computer work, the pelvis and the torso are not exactly aligned. The hips are going one way, the torso another. That's going to create an asymmetry between several back and abdominal muscles, creating a torque on your spinal joints and disc fibers. Same thing can happen if you're used to watching TV or computer screen or have a tendency to talk more to one side, let's say in a social setting. Repetitively, if you're doing this all the time, there's going to be a difference in your range of motion and being able to turn your head, your range of motion with your hips or your torso. That's an asymmetry that's going to aggravate discs. What we want to keep in mind is what do we have in terms of our pelvic misalignments or movement tendencies. You can find that out at the Posture Size or painfreeandfit.com website. We have a free body analysis. Check yourself out, look in a mirror, do some of the tests that are on the websites, figure out what your tendencies are because you're going to plug that into your sleeping position. If we have a tendency to, let's say, hip hike on one side, have one hip come higher, or a rib lean down, we're going to make sure that we're laying on our side sleeping with that side down. The reason is, if that side was up, we're going to have a tendency to, as we're laying on our side, because our hips generally are wider than our middle section or our waist, the pelvis is going to want to tilt so that there's compression on that side. Our shoulders are typically wider than our waist also. So the shoulders push us in the same direction. So that upper side is going to be compressed. If that's typically the way you sit and stand and move during the day, or if you have a tendency to turn that leg out like we talked about, that's going to further compress that disc overnight. When it's filling with water, now when you start to move in the morning, you have an asymmetrically loaded disc where it's being compressed on one side. That's going to be much more dangerous in terms of causing pain. So we always want to sleep with that side down so that if we put that side down, we can lengthen the leg on that side and raise the rib cage, lengthen my leg through my foot, raise my rib cage. Now I'm sleeping and I'm in a symmetrical state where that bottom side is opened up and not compressed together. If I have a tendency to rotate one leg, let's say this leg, I like to turn and place over my ankle during the day across my leg.
When I'm sleeping face up, I want to make sure that that leg has a pillow against the side of my leg or my foot that I can lean against to avoid that turning outwards. Otherwise, over the night, I'm tightening my piriformis, my external rotators of the hip. When I first move in the morning, that's mechanically going to put more pressure on my disc. I want to have symmetry. I want to avoid crossing the legs at night. If I have a tendency to twist my pelvis to one side, again, this is a common example. If I, let's say, sit with this right leg turned out more or stand or walk with that leg, and it causes not only hip hiking on that side, but it causes my main problem is pelvic rotation, where my pubic bone goes to the right more than my chest does. I want to be able to sleep so that pelvis is not turning to the right. If I'm sleeping with that involved side down, and I do what most people do during the night, which is to raise one leg up and turn the pelvis, that's accentuating that problem. Again, that's twisting not only my pelvis, but there's a slight twist that happens in my lower back. That's going to aggravate those disc fibers. They're being twisted to one side more than another. As water is creeping in or imbibing into that disc overnight, it's a more loaded pressure gradient right now. And when I go to first move in the morning, all my fascia, all my ligaments, all my disc fibers, it's all bound up into that rotation. When I get up and move, that asymmetric rotation is loaded with that extra pressure, much more likely to hurt myself first thing in the morning. So again, I would want to sleep the opposite way. If my pelvis usually turns pubic bone right, I want to sleep on my left side so that now, naturally, as I sleep, my pelvis is turning to the left. Again, you don't know this unless you do a thorough examination of your posture, your mechanics, your movement tendencies. Again, that's available on those pain-free and fit and posturesize.com websites. If I have a neck issue where I have a tendency to tilt side to side or rotate side to side, I want to take a mirror to look to make sure that in my side sleeping position, I'm not leaning into that problematic side. If I have a tendency usually to sleep or move or have an elevated shoulder on the left or tilt my head to the left, I want to make sure my pillow is high enough so it supports my head level or even a little bit further the other way, so I'm undoing my chronic tendency of compressing the discs in my neck on that side and overstretching disc fibers and soft tissues on the right side. If I have a tendency to turn my head to one side or another, I want to make sure I position myself on the pillow so that as I'm on the edge of the pillow, I'm not having a tendency to look down into that normal side, but I keep my head back or even with the pillow pushed up or thicker on the front portion so that my neck is actually in neutral or a little bit to the other side. So thinking about what type of posture tendencies you typically have during the day, what your normal symmetry is when you look in the mirror, you want to set yourself up when you're sleeping so that you're doing the opposite of these positions with degenerative disc disease. And that's going to be less likely to aggravate you as that hydration level increases first thing in the morning and you first start to move, which is when many people first feel their pains. They get up in the morning and they say, you know, I was okay in bed. As soon as I started to move, my back, my neck started to hurt me. It's because we're hydrating a degenerative condition with bulges, herniations, and we're hydrating them in an asymmetrical fashion that's not putting the correct mechanical pressure on that disc complex. If you like this video on sleep position and degenerative disc disease, check out our channel. We got a lot of great videos out there, not only with sleep positions and posture, but exercises to help you improve your condition and get you back active again. If you'd like to help me share this valuable information with others, give me a thumbs up below. Questions or comments, write in. I'll do my best to answer them. And again, if you're looking for a great program for degenerative disc disease and how to do a self-analysis on your posture, your movement tendencies, your biomechanics, how to learn corrective exercises that are unique and specific for you and get you back into shape and active again without hurting, check out our Fast Track program for degenerative disc disease available at the posturesize.com and painfreeandfit.com websites. I hope this video on sleep position and degenerative disc disease for your lower back and neck helps you with your chronic degenerative disc disease.